Welcome to the Aesthetics Today podcast, the premier platform where we explore the ever-evolving landscape of aesthetic treatments, regenerative medicine, and cutting-edge beauty products and technology.
I'm Apike, and on today's episode of the Aesthetics podcast, we are joined here today with Dr. Ed Robinson, an award-winning aesthetics doctor who is somewhat behind UK's most natural-looking transformations. On today's episode, we're going to be breaking down some skincare myths, some trends happening in the aesthetics industry, and why men are secretly booking in treatments too. Today's episode is proudly sponsored by Digital Aesthetics Agency, the leading agency in growing some of the clinics most successful in the industry through ethical and smart marketing. Thank you, Digital Aesthetics, for sponsoring this episode. And thank you, Dr. Ed Robinson, for joining us today.
Thank you so much for having me. It's an absolute pleasure to be here.
Oh, it's great to have you. I'm calling you all the way from, I wish I could say sunny South Africa, but we're heading towards the evening. But I know you're all the way from the UK. And I mean, you guys are heading towards summer. It's like my first question is, what's the weather like? Because I'm so envious of you guys. I wish I could be just sipping on a beach, sipping on a margarita on the beach doing this interview.
Do you know what? I'd be right there with you. We've actually just had like a bit of an unprecedented heat wave here, so it's been really nice. But that also means we've probably had our entire summer for the year. So you've really got to seize the opportunity while you can.
Oh, love to hear it. Love to hear it. Very envious. But anyway, let's get into the nitty-gritty of this interview. So let's start with your journey. Did you always want to be a doctor? Like, what was like your wake-up call or light bulb moment?
Do you know what? It was never something that I originally had planned for myself. I really enjoyed science subjects at school. I've always enjoyed helping people, did bits of volunteering and things in my early years. And it just kind of naturally gravitated towards it. I think when you do well at school, you're often pushed into careers like being a doctor, being a vet, being a lawyer. And the more I learned about the medical profession, the more I just really enjoyed it. And it's very much become like a vocation and a part of my personal identity now.
Oh, love that. And then when it comes to aesthetic medicine, what drew you into that side of medicine?
Yeah, so I had a pretty sort of roundabout route to going into aesthetic medicine, which is very common for people in the UK because it's not something that's really taught in the medical curriculum. So it wasn't something we covered at university. I did my medical degree at King's College London and then moved up to Manchester for my first 2 years of medicine. And I've always stayed here ever since. But I actually was introduced to it initially in COVID. So I did my anaesthetic training, started it in 2019, which was a terrible time to start. Because a lot of the anaesthetists were then put into intensive care where we were managing COVID patients. And obviously that was a really important part of, managing their care. And I'm glad that I went through that and experienced it. But as a result, became very burnt out with the NHS system and also just neglected lots of aspects of my own self and appearance. And I started having my own treatments quite shortly after all the lockdowns were lifted, and the enormous improvement that I got in my confidence as a result. And then the more that I learned about the treatments and saw how actually there's so much overlap in terms of my medical role and my anaesthetic specifically into delivering these treatments, I was like, I can do better than this. And so really that's kind of where it all came from.
Oh, wow. Kind of almost feels also like a full circle moment. But I mean, especially dealing with that during COVID must have been very intense.
Yeah, it was. It was not a pleasant time, but I learned an awful lot about, learned a lot in terms of intensive care skills, but also learned a lot about myself and what I wanted out of life, and also other ways which you can help people and improve their confidence.
I see. Okay, now just smoothly transitioning on just like the ethos and, the day-to-day of how you run. Could you maybe elaborate on how your understanding of anatomy and pharmacology benefits your patients cosmetically?
Sure. So, I mean, a large part of medicine is understanding anatomy, which is obviously the physical structures that make up the body, and physiology, which is how your body reacts to certain things, whether it's physical stimuli or sort of normal day to day processes and metabolism. And then you've got pharmacology, which is how drugs impact the body. And all of the aesthetic treatments that we perform are in some way taking advantage or tapping into these principles. And it's a very inherent and core part of being a doctor to know these things, and applying them to cosmetic treatments is so important to deliver effective results that look good, because you've got to understand anatomy, both static when things are still, but also with dynamism. So the way the face moves when you pull expressions, and then also the way that these treatments are going to impact the body. And, patients are complicated. They've got medical conditions, they've got different anatomy, they've got different medications that they're on that can interact with things, and having a full comprehensive understanding of those things is just so important to delivering safe treatments.
Oh, wow. I actually like what you said about having to understand not just the anatomy of each patient, because of course that differs from patient to patient, but even taking
Mm,
things into consideration, like the medication that they're on. That's also something that I've never even thought about. So yeah, I really, really like that. It's kind of like a holistic way of just looking at not only anatomy, but pharmacology as well.
exactly.
Yeah. So, for the audience who may not know, you have founded your clinic in 2021 with the
Mhm.
aim of applying your medical knowledge to benefit patients cosmetically. Can you tell us a bit more about what the philosophy looks like in your practice with your patients?
Sure. So it was actually only relatively recently, so this year, that I opened up my own clinic. So I've now got 6 members of staff and 2 skin therapists and a second nurse injector. Prior to that, I was an individual practitioner in my own space, so I managed the entire treatment journey. But for me and everyone who works with me, it's holistically understanding the patient as a whole, what they're like as an individual in terms of their anatomy, what their skin quality is like. So appreciating all the different layers that we're going to be treating. And
Mm,
also understanding their motivations for treatment, why they want to have these things done, what their expectations are, what their day-to-day concerns are, and how we can best tailor our treatment plans to those people. And also everyone's got different budgets and what they're prepared to
mm,
spend. And we spend a lot of time educating people about how these treatments work, both in the short term and the long term, but also tailoring treatments to people who, depending on what their budget is, basically, so we can get them the best results.
I like that. I like that. Um, Whether it's on your website or social media, you often talk about ethics in aesthetics medicine. Can you remember a moment where you had to turn a client away, maybe, or maybe just, I don't know, I guess change their expectations and how you handled that?
So, I mean, I can remember many. I can remember some today even. It's I spend I'm really good at talking myself out of making money. It's the easiest thing in the world to do what a patient wants and just perform a treatment on them and then charge them for it. But a lot of these
Mm,
treatments aren't suitable for their anatomy. They're not going to look good. Some of them can make you look older. Some of them can make you look more
yes,
tired. And just because
yes,
something worked for your friend or worked for an influencer, or you've read an article about something, doesn't mean it's going to work for your face, or your body, because we do body treatments as well. And so I think that's a really important part of why you have to go to a medical professional, why you need a consultation before you have a treatment, because we're all so different. And
yeah.
fillers in particular suffer from this concept called perception drift, which is that we do treatments for people and then they forget what they used to look like, but they associate having treatment with feeling better. And it can become a bit addictive for people, where they end up just wanting
Yes.
more and more and more. And that's always a scenario which is going to end up looking bad in the end. And so a lot of the time I'm educating people as to why I'm not going to treat them, why something's not suitable for them, and why they don't need any more of something.
I love that. I love that because that is the sad reality sometimes when it comes to the industry of aesthetic medicine. Patients tend to do a bit too much, especially,
Mm.
with the lip fillers. So I'm also just curious to know, has there also been a situation where even despite your, of course, professional advice, where the patient is still like, you know what, I'm not going to listen to you. I'm going to do my own thing. And I mean, do you still help them, or unfortunately, of course, they have to turn away to a different doctor?
I mean, it depends what the treatment is specifically. I mean, if it was if someone asked for one treatment, which I don't think is in their best interests, I'm always going to turn that down. It doesn't mean there are other treatments which can benefit that person. But I have treated patients before where I had someone the other day that we talked about doing some dissolving because they felt themselves and they had too much filler. They looked overfilled. And dissolved all of it in a couple of sessions, which I've sort of identified all of it with ultrasound.
Yeah.
And then I'd said, you need to wait at least 2 weeks before having any further filler treatments, and ideally with your lips, because the lips were very overfilled. They then contract down quite a lot when they're dissolved. You must wait a significant period of time before having more filler in the lips. And then I reviewed a couple of weeks later, and then she'd gone to someone else to have her lips done, and she was like, "Well, I just knew you weren't going to do it, and I really wanted it doing." And I was like, "Oh, well, yeah." That definitely wasn't what I advised, but you can help people as much as you can in person, but you can't force people or tell people what to do.
That is true. That is true. And at the end of the day, I mean, it's still great to see a doctor like you still push ethics in your industry, because I think a lot of patients value that even more than just telling them what you want to hear. So I think it's really great to see you still making it a priority to push your patients in the right direction, whether it's what they want to hear or not. But on the topic of fillers, we're kind of seeing a shift away from the exaggerated filler and heading towards more regenerative treatments. So regarding just trends, what are kind of the trends that you're seeing right now, and what do you think is driving those trends?
So yeah, you've completely hit the nail on the head there. So I still do lots of dermal fillers, but I do less than less than there has been. And one thing that's just really important to make a quick distinction on, by the way, is that in aesthetics there are kind of two arms to these treatments. There is feature enhancement, which is making people prettier in inverted commas, and it's a subjective thing. It's trying to harmonize people's facial proportions based on someone's opinion. And then you have anti-aging, which is very different and is more objective. And you are looking at the way someone's face has aged and performing treatments to replace volume that's been lost with age. So that should be more objective, and it involves more understanding of kind of the aging process. And they very much attract different patient groups. So younger patients tend to be drawn towards feature enhancement, whereas obviously aging patients go towards more of the anti-aging route. But I do plenty of dermal fillers for anti-aging because it's the only treatment that's going to restore volume. But fewer and fewer patients now are wanting these exaggerated feature enhancements. So fewer people want snatched jawlines, to use a word that they use, and heavy contoured cheeks and larger lips. And instead, as you said, they're opting for more skin regenerative treatments, and we see lots of those. They've existed for a long time, but they're becoming more popular. And that's things like laser resurfacing, microneedling, radiofrequency microneedling, and then injectables like polynucleotides and PRP, which are all about stimulating your body's own processes to restore youth in the skin and look better. And people like that because it doesn't involve products sitting in your face, and it doesn't involve drugs that are changing the way that your expressions are. It's considered to be more natural, I suppose. Some people would say, although my counter argument to that would be, if aging is a natural process, anything that you're doing as an anti-aging procedure is by definition then unnatural. But it's interesting how how the concept of naturality, I guess, is different from person to person.
Yeah, it is. It's very interesting. And even also just on the topic of polynucleotides
Yeah,
treatment.
that's right.
Yeah, I mean, also with that, there's also like a big trend amongst it. How do you compare it with traditional fillers? And what do you think people should know before opting to take polynucleotides as a treatment?
Yeah, that's a great question. So polynucleotides are incredibly popular at the moment, and for good reason. They work really well. They're a great treatment. One important distinction is that as far as injectables go, if you want to replace volume, whether that is from fat pads in your face, whether it's bone density, where it's muscle bulk, all these processes change in the face as we get older. Dermal fillers are the only treatment that will restore volume. So polynucleotides are not an alternative to dermal fillers because polynucleotides do not restore any volume. You might occasionally see people put before and afters where it looks like they've restored volume, but that's just because polynucleotides come as a water-based gel, which quickly gets absorbed. But immediately after you have polynucleotides injected, it looks like there's some volume in the face. But polynucleotides are there to stimulate collagen and elastin production. And they have this kind of longer lasting effect where they work as an antioxidant and prevent the aging process as well. So they're fantastic for drawing moisture into the skin, improving skin quality, but they will not replace volume. And one area that they particularly shine is the under eyes, where classically tear trough filler is often a bit of a terrible treatment for a lot of people, whereas polynucleotides is very safe, well tolerated, and a good solution to aging under eyes.
That's good to know. So in your professional opinion, what is a good age to start, I guess, considering taking polynucleotides as a treatment?
So I get asked this question an awful lot, like when is the correct age to start treatment? And the answer is boring and complicated, but there is essentially no correct age to start these treatments. So it depends on the individual. So I have patients who are in their early 20s and they live a very stressful life and they don't have much sleep and their nutrition isn't very good and they are showing signs of aging more so than, say, someone even in their mid 30s who looks after themselves really well and uses a lot, has a good skincare regime and wears SPF daily. So it really depends on the anatomy that you see in front of you. I am not a strong advocate at all for preventative treatments just for the sake of it in terms of injectables. So I think unnecessary treatments risk complications and downtime that's just simply not necessary before you're starting to get the signs of aging. And these treatments work incredibly well when you are starting to get the signs of aging. So I am a strong advocate for doing them then. I feel a bit differently about some energy-based devices. So things like lasers, microneedling. There's good evidence that they can follow this concept of collagen banking, which is that if you do things to stimulate collagen on the surface of the skin, it prevents your rate of loss. And they're much more cost-effective ways of doing that. Whereas, shoving loads of polynucleotides all the way throughout the face is very painful, very unnecessary, and there are much easier ways to stimulate collagen than that. So that's what I tend to say to my patients.
Yeah, that's very good to know. And I guess now, even on the topic still of like treatments and technology, what are some of your favorite treatments and technology that's happening right now? And even if it's off the radar, like what are you currently obsessed with?
So I am absolutely obsessed with our laser that we have. So laser resurfacing is becoming increasingly popular. It's loved by celebrities, and obviously anything that's loved by a celebrity is, especially if a Kardashian says something is great, then everyone suddenly wants it. Yeah. But it's for good reason. These lasers are, just in my opinion, the gold standard in terms of superficial skin resurfacing. And then there are stronger ones which are called ablative, so they cause a little bit more damage to the skin and can have even better results. But the one that I really love at the moment is it's by Cyton, so it's called the Moxie laser, which is for superficial skin resurfacing. And then we've got another device which is called broadband light, which the acronym is BBL, which causes lots of confusion when I'm promoting BBL because it's not the Brazilian butt lift, and people yeah. And so I don't know who made that marketing decision when they were making it, but anyway, it's fine. And that's a light-based therapy that targets blood vessels, pigmentation. It can help sebaceous glands produce less oil, so it's amazing for acne as well. And collagen stimulation, and the combination of those two is my absolute obsession at the moment. I've got this device to help my patients, but really it's for me. I'm just going to laser every inch of myself and never age. That's my plan.
Oh, I love that. I love that. Thank you for that. Oh, I wish I was in the UK right now. I would have right now. But anyway, what's one thing you wish your patients asked you more about during your consultations?
Oh, ask me more about. I think I spend a lot of time educating patients about treatments, and I think because so much of aesthetics information is consumed via social media, articles, things that people read. As someone who does a lot of social media myself, I can tell you that any content you produce will do much better if it's very black and white, slightly controversial, and doesn't really paint a whole balanced picture about something. And so often people have these preconceived ideas about things, and they come in wanting this very specific thing. And really, what I wish people did more is, rather than coming in asking for treatments, if they came in and talked more about concerns. And many of my patients do. So patients will come in and be like, I want this treatment this person had for my under eyes. And actually, the best thing to be is like, I'm just concerned about my under eyes. What are the treatments options available? And sometimes it's been quite hard actually having this discussion with people and turning them off certain things, because some influencer or someone on, someone that they like said it's the best thing ever. And actually having more of this discussion about appreciating anatomy and why certain things will work for you and why certain things don't. And so, like I said, spend a lot of time educating people about how these treatments work and what's going to work for an individual.
Oh, I love that. I love that. I mean, I've even seen the reviews you guys have on Google, and everyone always just ends up being super happy. So, I mean, you're doing a great job. So now we're just going to switch topics a little bit. There has been a rise in male cosmetics. And I know that you're a big advocate as well for, breaking the stigma around men and, seeking aesthetic treatments. So have you noticed any particular treatments that are more popular among your male clients?
Yeah, absolutely. So about 15 to 20% of my patients are men, which is definitely above the average clinic amount. So usually I think it's something in between like 11% or something like that is a normal kind of percentage of male patients or clients, however people refer them to. I think probably past that is because I am a man, but also, we are a very inclusive practice. We welcome, everyone here. And I do spend a lot of time talking about how beneficial these treatments can be, regardless of your gender. I spend a lot of time talking to men about this concept of pretty privilege as well, which we can go into a little bit. But what I say to people that because so many women for such a long time, have. I'm not going to say they have to, but people feel like they have to do something to improve their appearance, whether it's wearing makeup every day, whether it's having a skincare regime, whether it's having, and it goes all the way up to injectables and surgery and things like that. It's it's almost generally accepted and assumed that women are going to do that. Not that that's necessarily right, or it's something I approve of, this societal pressure. But for men, the bar is set so low. So few men do things to modify their appearance. You don't really have to do very much to significantly elevate your appearance with these treatments. And that can be just something as simple as having a skincare regime, educating about daily SPF use, which is going to slow the aging process. But the kind of procedures that I'm seeing a lot more of, I've seen this large rise in Botox, in men, and this is usually for anti-aging. So you can knock quite a few years off your appearance by treating the frown lines and the forehead lines. But the approach to treating a man with these anti-wrinkle treatments is very different to that of treating a woman. And I think that's part of understanding anatomy and understanding how the face moves as well and expressions are pulled. So the example that I give is that women often want an arch in their brow. So the positioning of your Botox is very different to a man, because a man wants to have a flat brow. Because if a man has an arched brow, it tends to make them look a little bit feminine. So understanding how a man's face is different to a woman's is incredibly important. And likewise, not everyone realizes this, but the muscle that raises your eyebrows also lowers your hairline. And hairlines are quite important to men, especially as they get older, because they tend to recede. And if you do Botox in a heavy-handed or not in a not particularly great anatomical way, you can make the forehead appear larger and you can make the hairline get pushed back. And men generally aren't very happy when that happens. So understanding these things is very important in terms of delivering these treatments. And then the second kind of thing that I'm seeing a lot more of is, as we were talking about before, these skin rejuvenating treatments. So we're getting lots of men booking in for lasers and skin resurfacing, because I think, we mentioned taboos and stigmas surrounding treatments, but for some reason, these lasers, skin resurfacing treatments don't carry the same stigma that needles do and injectables. And I think it's probably because there's this concept of these injectables being beauty treatments, whereas actually
Yeah.
they're not. They're medical anti-aging treatments. But lasers and skin resurfacing people don't seem to be as concerned. They're less likely to hide that they've done it. They're happy to tell people, especially when they see how good the results are.
Yeah. But I love all of that, and again, I appreciate breaking the stigma of men, in the aesthetics treatment industry. It really is nice to see, in my personal opinion, men taking care for after themselves because. Like for example, 3-in-1 skincare routine is just horrendous. So
Oh
just
no, it's the
seeing
worst, isn't it?
it's the worst. So actually seeing men even go beyond and just seek out Botox, for example, it's really great to see.
Yeah,
So
exactly.
yeah. And then, moving on to, breaking skincare and industry myths.
Mhm.
Personally, I would like to know, because especially after doing treatments, just for example, like microneedling, there's always this, I guess, myth that you need so much hydration. And I think it would be nice to hear just from a professional, how much hydration do you think our skin actually needs? Or are we overcomplicating it, especially after treatments?
Sure, I'm so glad you asked that. So and this is kind of something that I say a lot about the aesthetics industry as a whole. There is so much money to be made both in oversimplifying things and overcomplicating things to sell products and treatments.
Yeah.
And it is no surprise that patients are confused about what they're supposed to do or what treatments they need because it's an absolute minefield. And as long as you boil things down to principles of anatomy, physiology, and pharmacology, it is relatively straightforward, but it takes a full understanding of this and a lot of experience with managing skin to really appreciate how these things work. And in terms of specifically when you ask about hydration, we are the product of millions of years of evolution. We have very simple reflexes and connections with our brain and our organs in terms of how much hydration that we need. If you are thirsty, then you need to drink some water, and if
Yeah.
you drink more water than you need, you're just going to you're just going to wee more. So in terms of the hydration that you consume, it's really not complicated. I think we do live slightly more complicated lives now than we used to when we were like cave people. So we
Yeah.
probably do more things that dehydrate us. But in terms of hydration, it's very straightforward. If your skin is dry, then you can moisturize. If your skin is not dry, then you really don't need to moisturize. You have a skin barrier, which is combination of the external skin cells that you have, the top layer of your skin called the epidermis. You've got bacteria on your skin, which are good bacteria, and they help maintain your skin barrier as well. If your skin barrier is functioning properly and it's not impaired, it is very effective at keeping your skin moist. And as you get older and you start to become perimenopausal and menopausal, that skin barrier becomes less effective. So you may need to moisturize slightly more. But for the average person, if your skin barrier is intact because you've not damaged it with, unnecessarily abrasive skin treatments, or you're not, I don't know, in the Arctic and getting loads of like cold wind on your face all the time, then there really is no need for extra moisturizing. Simple moisturizers as part of your skincare regime are great, but if your skin isn't dry, you don't really need to moisturize.
So it's really that simple. It's really
Yeah,
just, dry equals moisturize, not dry equals don't moisturize. It's really
exactly.
simple.
And
Huh.
then where it can become a bit more complicated is if people are using skin treatments to achieve some kind of aim. So we often get patients with acne, and part of acne treatment is using actives like salicylic acid, retinoids like tretinoin, and things like that, which will dry your skin out. And in situations like that, it's important to moisturize. But even if your skin is not incredibly dry, in this kind of regime, it's important to keep moisture because otherwise your skin will overproduce oil and it can make your acne worse. But that's a different thing. That's treating skin disease. That's not just optimizing a normal regime for people.
Yeah.
The only other time where it's a bit different is if you're using your moisturizer as some kind of delivery system for another active, whether that's vitamin C, salicylic acid, or these other things. Then sure you can use a moisturizer there. But one by itself, only if your skin's dry.
Yeah. I mean, I wish I knew you like 3 years ago because I was overcomplicating my skincare routine and my skin suffered for that. But exactly like you said, we need to stop overcomplicating it and sometimes just not fall into social media
Yeah,
gimmicks and marketing because that's just what it is. It's always just marketing that just deludes us.
Exactly. And this is something I say all the time. Again, as someone who does a lot of social media, and I know things that will increase your reach and things that are less likely to get reach. But if you make a video that's like, oh, here's my balanced argument about why salicylic acid is appropriate for this person's skin, but might not be appropriate for this person, no one watches that video. But if you make a video that says something like, this is the one thing you must have in your skin regime, and if you're not doing it, your skin's going to suffer. Those are things that people click on and watch. And you know, it's the social media game, isn't it? But it shouldn't be that way.
Yeah, it shouldn't be that way. It's a bit toxic, but I mean, it is what it is. And then again, just on the topic of industry myths, like what is one industry myth that just like absolutely drives you mad? Like you cannot believe that people still believe in this.
Is that it's really these anti-aging treatments make you look fake, and so many patients come in and say, oh, I'm worried about this because I don't want to look fake. And it's like, well, to be fair, it's actually quite unusual that these treatments make people look fake. But what you don't see is all the people that look good, because you can't tell they've had it done. And that's how it's supposed to be. When you can tell someone's had a treatment done, as far as I'm concerned, that's treatment failure. So they should be undetectable. And in the media, in social media, in news articles and things like that, they like to make an example of bad work. And so those are the images that stick in people's minds. But actually, the vast majority of these treatments don't make you look strange. And when they're done properly, they respect your anatomy and they're done in an ethical, proper medical way, then they look fantastic. And like I said, they're oftentimes so subtle you can't almost tell what's been done, but you can tell that you look rejuvenated and more awake and a little bit younger. And that's how it's supposed to be. But having that discussion with people sometimes is a bit of a battle, mostly because of stuff they've seen online.
Yeah, 100%. So you run a CQC registered clinic, placing a strong emphasis on ethics and safety. Could you just walk us through or elaborate more on how that looks like behind the scenes?
Yeah, sure. So one thing that's important to stress is that ethics is the cornerstone of medical practice. Everything that you do in medicine should be ethical. Every prescribing decision you make, you should be weighing up the ethics of whether this is an acceptable thing to deliver to a patient or not. And in the UK, CQC registration is not mandatory for aesthetic clinics unless you're doing certain procedures, like administering IV medications, doing thread lifts, which count as a minor surgical procedure, and there are some other things that fall into those categories. But we made the conscious choice to register with the CQC because it demonstrates that we are practicing at a certain standard. And the CQC, so the Care Quality Commission, is the body which regulates GP practices, hospitals, dental practices. And in order to meet their requirements, you have to have policies in place. You have to have standard operating procedures about what you're doing and why you're making the decisions that you're making, as well as multiple safety protocols in terms of, how do you approach treating a disabled patient? How do you approach, do you have a hygiene policy for this? How it's very, very comprehensive and, requires creating and understanding and practicing of about 150 different policies and ensuring all of your staff are trained to a high standard, and by being part of that process, that's how we demonstrate that we're really good at what we do.
Yeah, I love that. I mean, seeing that you guys are a CQC registered, I was like, this is important as well for patients in choosing who their practitioner is going to be. So
Absolutely.
I mean, yeah, it's fantastic what you guys are doing.
Thank you, and I hope it becomes mandatory. Because the industry needs to be regulated in the UK more than it is. And these are medical treatments; they're not beauty treatments, and they should be treated and assessed as if they are.
Exactly, because I mean, even in doing my own research, I've seen that aesthetic medicine really is kind of more lenient in the UK versus the rest of the world. So I agree 100%. It's very important for a lot of these clinics to aim to CQC registered.
Exactly, and I mean, you say more lenient, but I don't think it's the only country in the world, but I don't think there are very many where legally anyone is able to administer these procedures. So people can order these medications online. They come pre-filled in a syringe with a needle, which is absolutely ridiculous. It's not the easiest thing to do, but people do. And then there is no law saying that you can't inject your friend. You don't have to have done a training course. You don't have to be insured, and they've got no recourse to do anything if they get a complication as a result.
It's
If any,
insanity.
I know it's completely ridiculous, and unfortunately, when complications happen, it's the NHS that has to pick up the slack, or other aesthetic practitioners, because, as I said before, the aesthetics isn't really covered in the medical school curriculum. So a lot of A&Es and things like that, although this is changing a little bit now, they're not actually equipped to manage these complications. So because it's just not something that's really taught about.
Yeah.
And it's something that we're seeing more and more. I think that it was in the news yesterday. There was this practitioner who was a non-medic, who had done all these BBLs. We were talking about BBLs before, but the actual Brazilian butt lifts, so the,
Yeah.
the filler butt lifts. And he had multiple patients who got life-threatening sepsis and things as a result. And the only thing that's happened to him is he's been barred from injecting for like a finite period of time by certain local councils. And there's just, it's there's a huge gap in the law, and patients suffer as a result.
Yeah, which is very unfortunate. It's a very, I mean, in as much as it's a very great industry because it really does help people feel better about their appearance, but it's also very scary because you're also putting like your body kind of permanently into the hands of someone who's
Mm.
not even a professional and who just, maybe watched a YouTube tutorial on how to do it. It's very, scary and imbalanced. So, hopefully as we move towards the future, more practitioners just become more, CQC registered. Here's hoping.
Yeah,
But yeah, now moving hopefully into a little bit of a lighter topics. But
good.
without naming names, you've worked with a number of high profile individuals. What cases or, I guess treatments have been memorable for you with some of your patients?
Yeah, so kind of tying towards what we were talking about before, it's all about skin rejuvenation. So people want fewer fillers, especially if it's feature enhancement, and even if it's anti-aging, there are people who don't want them, and even including Botox and things like that. And so I spend a lot of time doing skin rejuvenation at the moment for these for all of my patients, but some of the high-profile ones as well. And it's really satisfying because watching someone's confidence improve as a result of doing these skin rejuvenating treatments, whether it's using lasers, microneedling, and I use lots of exosomes as well. So these are these kind of special messengers that act between cells, and you apply them topically, and they reduce the downtime of your treatments, and also improve the results. And for some of these people, they're either going to be on TV or they're presenting something, so they can't tolerate a lot of downtime. So these exosomes are great adjuncts to treatments to reduce that. And yeah, I've had some very good results.
Yeah, I love that. I mean, I've been looking at your social media and seeing the results. It's beautiful and fantastic. Hence why I wish I was close to you right now, but it's fine. So
Well,
maybe
you're welcome
before the
anytime. We're just a quick flight away.
yeah, exactly. I'm gonna plan one by before the end of the year. But yeah, besides skin treatments, you also specialize in doing hair loss. How do you determine the best treatment plan for a patient experiencing hair loss?
Sure. So yeah, hair loss is a large amount of my practice, and I get a lot of satisfaction from it. Including personal satisfaction. So I had a hair transplant 2 years ago. As far as I'm concerned, in terms of my own cosmetic treatments, that was by far the best money that I ever spent in terms of improving my confidence. My dad's genetics kicked in when I was in my mid-20s, and my hairline
Oh
was just like
no.
moving back half a centimeter every day or so. So for me, it was a very emotive thing, and I really enjoy helping other people with hair loss, because I understand how debilitating that can be. And it's not all just about men as well. So interestingly, most marketing for hair loss is directed towards men. And obviously they've got a very distinct pattern of hair loss, this male patterned hair loss that, is you get this M-shaped hairline, the temples recede, and then the hairline moves back.
Yeah,
But actually, pretty much as many women experience hair loss in their life as well. It just tends to be more generalized thinning that happens with perimenopause and menopause. And the dialogue surrounding that is increasing now as people talk more about menopause more openly. And actually, when you ask female patients, yeah, they all are all experiencing hair loss as well, and it affects their confidence. So I gain a lot of personal satisfaction in terms of helping people. And also, a lot of the treatments that I do for hair loss involve injections, and some of them can be quite uncomfortable. But using my anesthetic background, I do a scalp block. So that involves just a couple of injections of local anesthetic, and then it makes the scalp pretty numb. So you can tolerate these injections really, really comfortably. And I don't like doing procedures on people that they find uncomfortable. So it's great for me as
Yeah.
well. Um, in terms of how I assess people, it's all about the consultation, and it's all about understanding why their hair, why they've got hair loss. Is it just age related? Is it hormone related? There are lots of medications that cause hair loss. There are diseases, things like diabetes, high blood pressure, having high cholesterol, heart disease. All of those things contribute to hair loss as well. And it's really important to fully assess someone and work out what the underlying cause is. And then it's all about holistic approaches. So you want something that's going to address the hormonal cause, ideally. You want something that's going to improve blood flow to the scalp. And then you want something that's going to stimulate the hair follicles to grow more. And so combination treatments are absolutely the superior way of treating hair loss. And I do a lot of that in my practice.
I love that. I mean, this even ties to our very first question about just, using anatomy and pharmacology as like a holistic approach into assessing a patient. So yeah, I love that. And then now we're moving on to our last question, which is just now looking ahead. And, regarding your clinic, where do you see your clinic growing in the next few years?
Yeah, so it's we've got lots of exciting plans at the moment. So I spend a lot of time doing aesthetics, so improving people's appearance in some way or other using non-surgical means. But also the way the industry is moving as well is so, it's great to make people look good on the outside, but it's even better if you can make them feel good on the inside as well. And also understanding how the face ages and how, your skin is a manifestation of how healthy you are on the inside as well. And so patients quite rightly expect more from their treatments. They want holistic assessments. And if you can optimize people's medical health, and if you can optimize things like hormones and their diet, exercise regimes and things like that, they will get so much better results from their treatment, and they'll also feel a lot better as well. So we have a hormone, like a hormone replacement therapy specialist, so menopause specialist, who's going to be starting in the next few months. And that's going to be, many of my patients are menopausal, and so it's only natural that we would want to help address hormonal imbalances which people experience in menopause, because essentially most of these aesthetic treatments are cosmetic menopause treatments, because you're looking at the way the face ages. And hormone replacement therapy and treating these underlying things can slow that rate and also improve the way you look as well. And so this concept of wellness is something that we're definitely moving more into, and that requires CQC registration. So that's the other reason why it's very important to have that, because it's one thing doing injectables, it's a totally other thing improving patients' health and working more towards that holistic aspect.
I love that. I love that. Well, I'm wishing you the very best of success. I mean, this is why you're an award-winning doctor. But yeah, thank you so much, Dr. Ed, for joining us. This has honestly been very insightful and refreshing, and I'm wishing you the best of success in your practice. And I will be seeing you before the end of the year. I'm making an appointment.
Thank you so much for having me. Honestly, it's been an absolutely lovely break from a busy clinic, and I'm more than happy to see you whenever you want.
Oh, thank you. Thank you. So, and all to our listeners, if you guys want to learn more or even book an appointment, please go visit Dr. Ed Robinson, and his website is dredrobinson.co.uk, or you could follow him on his social media, which is Dr._Ed Robinson. You can find him on Instagram, TikTok, and YouTube, and Facebook. I mean, nobody really uses Facebook, but you'll find him there. But yeah,
Someone must be somewhere.
someone must be there somewhere. But again, thank you so much again for your time, Dr. Ed Robinson. And guys, don't forget to subscribe, rate, and share this episode for anyone who'll be interested. I'm Wapike, and this has been another episode of Aesthetics Today. Thank you so much again, Dr. Ed Robinson.
Thank you.